Hi everyone, welcome to my presentation on Encopresis in children with autism. My name is Eric Cervantes and I am a student at Western Connecticut State University. In my introduction, I'm going to go over what is Encopresis, what is applied behavior analysis, and why is this important. Encopresis is the repeated passage of feces into inappropriate places, whether involuntary or voluntary. There are two types of encopresis. You have with constipation and overflow incontinence, and without constipation and overflow incontinence. So let's go into a little bit more detail of what constipation is kind of looking like. It looks like a poorly formed bowel. There's linkage. It occurs during the day, but it typically resolves after treatment. The second type, without constipation, is a normal form and consistency, usually in the presence of a conduct disorder, and is less common than with constipation. What is applied behavior analysis? As defined by Cooper, Heron, and Howard in 2007, applied behavior analysis is a science in which the principles of the analysis of behavior are applied systematically to improve socially significant behavior, and experimentation is used to identify the variables responsible for behavior change. So what's the significance between autism and ABA, and why is it important to focus on toilet training? So autism, people who fall on the spectrum, tend to have a harder time achieving continence of both urine and bowel movements. Applied behavior analysis has been successful in treating urine and bowel incontinence. There's a lot of research to back that up. As well, bowel incontinence tends to restrict access to educational opportunities. There's a social stigma involved by wearing a diaper, and just a decrease in independence. So what were some key points in the literature? So I'm going to talk about two. There's two methods used in the literature. There is punishment procedures, as seen in Butler and O'Brien's study, as well as multidisciplinary approach, as seen in Fryman, Hofstadter, and Jones, as well as Call, Mevers, McElhan, and Schwattheyer's studies. The first one I'm going to go over is a punishment procedure. What is a punishment procedure? It is when a consequence decreases the future frequency of a similar response. So why was it used? Butler developed his treatment plan based off of Azrin and Fox's overcorrection procedure. He pretty much did a replication to show that, if Azrin and Fox's overcorrection procedure can be used to treat urine incontinence, then why not try it on bowel movement incontinence? And it worked. And then O'Brien, she used a punishment procedure because two boys were not achieving continence as fast as the other boys in her study. A multidisciplinary approach. What is it? It involves the use of a psychiatrist, a pediatric gastroenterologist, and a board-certified behavior analyst. Why was it used? It was used as an alternative to punishment procedures. Researchers were also seeking cost-effective methods and faster result times. And my key points 2.0, I just want to go over a couple more things that were found in the research. I do want to point out that not every article focused on autism. However, these studies were influenced by studies done on children with autism and were successful. I believe it is important that ABA can be used on someone who does not have autism, so that is why I included it. Also, the focus on my paper was to find the best method to treat Encopresis and autism, and unfortunately, not many children with autism are diagnosed with Encopresis as much as their typical counterparts. The mean age of participants in each study was around 5 or 6 years old. The oldest was 21. And now the last key point, parent noncompliance as a factor. It was reported by the researchers that a possible variable could be that the parents did not run the treatment correctly. In the analysis portion of my presentation, I will go over my insight, possible paths of future research, and give a very rough example of how to implement a procedure to treat encopresis in children of autism. What's the best treatment method I found based off of my research? I can confidently say, after researching the different methods and comparing the duration of treatment amongst these methods, that a multidisciplinary approach is the most effective when treating a child diagnosed with encopresis and autism. However, punishment procedures may still be the best method depending on the child, and there's still more research to be done on both. Where do we go from here? Cost-adjusted or application of a study should be done to test the effects and treatment of a multidisciplinary approach. There can also be a comparison of a multidisciplinary approach versus punishment procedures, or a comparison of similar studies to determine which approach is indeed the best in treating encopresis with children with autism. A generalization program is another path to take. Call's study suggested a generalization program be created and implemented since generalization of vowel consonants did not occur outside of the clinic. Other articles either stated that generalization did not occur or did not mention generalization at all. Parent training is suggested and could possibly help out with the generalization part of the program. If a parent is implementing the treatment protocol incorrectly, there needs to be treatment integrity done to ensure that the training is sufficient. The next thing I want to go over is a sample protocol. I do want to point out, since I am not a board-certified behavior analyst, that this sample protocol should not be duplicated unless you consult with an actual board-certified behavior analyst. I just want to give a bit more of a preview of how this is done and how it is used to treat encopresis in children with autism. So the first step is you need to get a diagnosis of encopresis by a psychologist or a psychiatrist. Then an initial assessment is done where the child undergoes a screening from a pediatric gastroenterologist who will then suggest whatever the counter medications you can use to treat constipation. A preference assessment is done by a BCBA or behavior therapist to provide positive reinforcement to the child when a consonant bowel movement occurs. A little bit more detail about preference assessment. It's generally just used to help determine what the child is interested in. So examples can include edibles such as candy or a toy. Now we have the actual protocol of what this would look like. So this protocol would be used both in a clinic and home setting. You see that the first step is scheduled sits, so you have 10 minutes on the toilet and 1 minute off. Following consonant bowel movements, therapist helps the child clean up as soon as possible. Then 3 minutes of reinforcement is given with the preferred item, which you identify through the preference assessment, followed by an exit of the bathroom. However, if in the first hour of the protocol a bowel movement did not occur, a suppository is administered along with a 5-minute break out of the restroom. If no bowel movement occurs in the following 30 minutes, a second suppository is given. If no bowel movement occurs after the second 30, the protocol would then end. So this is the end of my presentation. Now I'll go over a couple of questions that are asked when I presented to family and colleagues in the Q&A. So there were 3 very common questions that I got from my family and colleagues. One was, where did I get this idea from? So I got this idea after seeing 2 clients at the clinic I worked at achieve urine continence but have a difficult time achieving bowel continence. I just really wanted to know if there was a reason for why they couldn't achieve bowel continence, and I kind of found my answer with my research project. The second question that I got asked a lot was, what is a suppository? A suppository is a small glycerin-based tube that has medications inserted into it. They are shaped like small bullets and inserted into the anus. And the last question, how does a suppository work? When the suppository melts, it softens the stool for easier passage. It can also hydrate the stool if it's very hard, making it easier to pass. So this is called a hydration suppository, which can also help the muscles in the rectum to contract. A suppository can also help with irritation in the rectum. If anyone has any other questions, please feel free to comment on my presentation or email me at cervantes002@connect.wcsu.edu. So guys, that's it for my presentation. I just wanted to thank each and every one of you for sitting and watching. I hope you guys enjoyed it as much as I did making it. Thank you once again.